My name is Daniel. I'm the fellow here in endourology and minimally invasive urologic oncology at Thomas Jefferson University Hospital's Department of Urology. Here we have Dr. Lallas, one of our senior and expert robotic surgeons, completing the second half of the guided urethrovesical anastomosis module here on the RobotiX Mentor system by 3D Systems, Simulation Systems. My role today is to sort of tell you how this is useful to us from a trainee standpoint. I'll tell you that from a trainee standpoint, this part of the operation is one of the most stress-inducing for the attending surgeons and also for trainees. What that means is that you may not necessarily get to do this in the operating room until the end of your training, if at all, depending on the comfort level of the attending surgeon. So the nice thing about this system is this lets us do this multiple times in a fairly comfortable environment and practice this very difficult part of the operation. So in our own research, we found that in a survey study of responding urology residency programs here within the United States, 85% of them do have some form of a surgical simulation lab present and available for their trainees. Of those responding programs, however, only about 50% of them have virtual reality simulators available for use. The other 50% are using mostly physical training consoles. The reason that can sometimes be problematic from a training standpoint is that those training modules are oftentimes, they're called backpack modules. They're connected to the physical Da Vinci console that's in the operating room, and the drawback is that if there are cases scheduled, which there often are at busy medical centers, as a trainee you're not able to use those simulators. Additionally, some programs require that an attending physician has to be present with the trainee using those backpack modules. Again, you may have an attending that's kind enough to take time out of their schedule to be there with you and train, but unfortunately that's not always the case. So this simulation module allows us to come in 24/7 on our own time to be able to use these simulation modules. Additionally, in these programs, the 50% that don't have virtual reality modules, of these responding programs, only about 18% of them have validated curricula for their robotics training. A great aspect of this particular module that we're seeing here, the guided urethrovesical anastomosis, is it really gives you a good sense of the precision that's required in a robot-assisted laparoscopic radical prostatectomy. What we can see here is we're within the true pelvis of a male patient. That actual working space, if you were to look at it with your naked eye, is about this big. So this gives us about 10 times magnification, very nice magnified working space, and we can see the anatomy just a whole lot better than we can in an open procedure. So these guidance dots here, these being yellow, turning to green when the suture placement is proper, gives the training surgeon and the advanced surgeon an idea of where optimal suture placement is. This preserves the urethral stump. It keeps us from damaging the muscular sphincter that maintains urinary continence. And more importantly, it gives us an idea of where we need to throw our sutures at the bladder neck to avoid damaging the ureteral orifices. In fact, prior to this module on the same RobotiX Mentor program from 3D Systems, there is an anatomy identification module which is helpful in identifying the relevant anatomy, that being the urethral stump, the bladder neck, and looking inside the ureteral orifices, as well as the neurovascular bundles which contain the cavernous nerves, which are most important for preservation of sexual function after robot-assisted laparoscopic radical prostatectomy, and also involved in preservation of continence. In fact, if Dr. Lallas were to stray from his normal expert path here and purposely take a large bite, it'll say that you may be ripping the urethra. It will say perhaps you're damaging the neurovascular bundle here. These are all very helpful metrics to us as training surgeons and as improving expert surgeons to get even better at an operation that we may have done many times. In addition to the RobotiX Mentor, 3D Systems also offers the Lap Mentor simulation program, and that is very important to allow the robotic assistant to develop the necessary basic and advanced laparoscopic surgical skills to be a good assistant. We always say in surgical training circles that the best assistant is someone who knows how to do the operation as well as you know how to do it, or even better. So having a virtual reality platform to develop those basic skills is quite important. That involves 3D spatial recognition, trying to see what I'd say there. That would involve 3D spatial recognition, use of tools to help the surgeon, and in terms of anticipating the next move, the Lap Mentor system is also helpful in that sense. The team training aspect of the 3D Systems Robotics Mentor is particularly useful for our more junior level trainees. As you move along through your urological training, you'll start by watching videos, looking at online modules, becoming familiar with the assistant role of the bedside assistant surgeon. That's tough to do unless you're invited into a case to actually help to assist. The Lap Mentor and Robotics Mentor systems, however, do allow us to do that in a simulation setting. You can see here at the main console, this would be analogous to what you would see as the bedside surgeon. You're standing by the patient's bedside, you're manipulating laparoscopic instruments, and in the team training modules, you can have a more senior surgeon or expert surgeon at the console, and you as the bedside assistant surgeon with the team training can see how your movements help or do not help or hinder the expert surgeon. Ironing that out is important in a simulation environment before going into the operating room. Operating is a whole lot like dancing. Perhaps the first time you dance with a new partner, you don't move together very well, it's not very fluid or smooth, but after doing maybe 3 to 5 dances with them, you start to develop a chemistry and a working relationship, a dancing relationship, and the team training modules allow us to do that with senior surgeons and assistant surgeons.